Good morning everyone, Shraddha Vasnik here. In today's lecture, we are going to study about the anticholinergic, which are also known as parasympatholytics, and cholinergic blocking agents. These are the pharmacological agents which, when administered, they blocks the action of acetylcholine in parasympathetic nerve fibers. For example, atropine. Now, the pharmacology of atropine. The mechanism of action of atropine on eye. It produces dilation of pupil of eye, which is known as mydriasis. It increases the tension on the lens. Is the size of pupil of eye is increases, this condition is known as mydriasis. In this, focal length is also increases. The person can see the object which are far away but unable to see the object which are nearer to him, known as cycloplegia. With the person is fails to respond to bright light, and the condition is known as photophobia. This is the action of atropine on eye. Then the action of atropine on gastrointestinal tract. It causes decrease in tone motility of GI tract. Therapeutic uses of atropine. Atropine used in the pre-anesthetic medication. It is used in the treatment of organophosphorus poisoning. It reduces the GI secretion in peptic ulcer, and also used in the examination of eye, as it produces the dilation of pupil of eye. The side effects of atropine includes mydriasis, cycloplegia, photophobia. It also includes increase in the heart rate and increase in blood pressure. It causes decrease in secretion like bronchial secretion. It also causes the dryness of mouth. Now, atropine or belladonna poisoning. Atropine is obtained from the Atropa belladonna. The main cause of atropine poisoning is overdose during the treatment. The sign and symptoms of atropine poisoning includes mydriasis, cycloplegia, and photophobia, which also includes increase in heart rate, increase in blood pressure, and produces dryness of mouth. The treatment of atropine poisoning includes the hospitalization and gastric lavage, endotracheal incubation, forced diuresis, and prophylactic antibiotics. The hospitalization and gastric lavage, as we seen in organophosphorus poisoning, it includes if the patient is conscious and if within 3 to 4 hours after the ingestion the patient is hospitalized. The vomiting is induced by syrup of ipecac or concentrated salt solution. And if in case the patient is unconscious, the simple stomach wash and removal of gastric content is done. Endotracheal incubation. If the respiration is slightly affected, oxygen can be given by nasal catheter. The endotracheal incubation is done when spontaneous respiration is needed and also to remove secretion. Then forced diuresis. Diuretics like mannitol, furosemides are used to increase the excretion of atropine. Then prophylactic antibiotic. These antibiotics are given to prevent the infection. And drug treatment include physostigmine 1 to 4 mg. The catheterization is advised for the management of urinary retention, and the patient is advised to keep in dark room due to it is the side effect of atropine poisoning that patient suffering from photophobia, which fails to respond to bright light. This is about the atropine mechanism of action, atropa poisoning, and anticholinergic parasympatholytic, or which is also known as cholinergic blocking agent. Thank you so much for being there.